So yes, TUXEDO-3 was a prospective, single-arm, multi-center, multi-cohort Phase II trial looking into the potential activity of Patritumab deruxtecan in patients with active brain metastases. And we looked into patients with active brain metastases from breast cancer, that was cohort 1, non-small cell lung cancer cohort 2, and leptomeningeal disease from any solid malignancy. The reason we did choose Patritumab deruxtecan, the third generation HER3-directed ADC, in the context of patients with brain metastasis was because we have observed an upregulation of HER3 expression from primary cancer to brain metastasis in non-small cell lung cancer and breast cancer as well. And so the primary endpoint analysis of all 3 cohorts has already been published and has shown substantial activity of Patritumab deruxtecan in all 3 cohorts. And we have observed responses and activity across all 3 breast cancer subtypes as well, so HER2 positive, triple negative, and hormone receptor positive HER2 negative. Now, interestingly, HER3 was also believed to be related to resistance to HER2-directed drugs. So an upregulation of HER3 might be linked here. And that's the reason why we specifically looked into the activity of Patritumab in the subset of patients with HER2-positive breast cancer from cohort 1 and cohort 3. And overall, 10 patients with HER2-positive breast cancer were treated in these 2 cohorts, 9 in cohort 1, 1 patient in cohort 3. And here, at a median follow-up of 8.1 months, we have seen a clinically relevant median progression-free survival, intracranial progression-free survival of 6.3 months. So that's, I believe, quite exciting. Median overall survival was 8.1 months. And when you look at these data, you need to remember that this was a very heavily pretreated population. All of these patients had received prior T-DXd, 6 out of 10 also prior to Patritumab, and 3 out of 10 also prior TD1. So overall, heavily pretreated population and still relevant progression-free survival. So although this is a non-pre-planned retrospective analysis, small patient sample, it suggests that Patritumab deruxtecan might have activity after T-DXd, and therefore future trials looking specifically into this patient population are warranted.